On PM Express tonight, implementing the medical drones policy, the concept versus the reality. When we first tackled this story last week, we were looking at the contract terms and we debated the cost implications. But the story has traveled far along since last week that we looked at it. Now it's been approved, but the controversy hasn't ended. Today, post-approval, we can only examine the implementation going forward because government is absolutely determined to go ahead with implementation. So how do you strike a balance between the concept as dreamt by the government and the reality in the health sector right now? That's what we'll be trying to explore on PM Express tonight. There are a few facts that we'll look at in terms of how this has traveled. We know that Parliament, by a majority decision, approved this a couple of days back, and this was very controversial, even in Parliament itself. We know that, in essence, we'll be deploying drones to deliver not only blood, but essential medical supplies to health facilities across the country. The company, Zipline Company Limited, in partnership with the Ghana Health Service, will be doing these deliveries. The legislators in Parliament had been divided over this matter. Minority say, apart from raising the issues with the cost implications, they had also raised issues with the need for this at this time in our history as a people. They also raised a key point of contention between the two sides was the cost of the project, which we dealt with last week. We know that the minority had maintained that the amount has been inflated. The Ghana Medical Association joined the fray, and that's when this really got very heated. Yesterday, they issued a statement. They were asking for a suspension of the deal, and as they're against the needs of the health sector, they believed should have been prioritized. And so the issue of a priority was key to them. They also says government failed to consult them, which is a fundamental point they made yesterday. And so they went ahead to say, if you fail to consult us and want to implement a policy that we will have to supervise and implement in the various communities, then you better suspend it and consult us. Now, it also says the GMA's consent says that the services to be provided by the drones do not conform to the existing primary healthcare policy in this country. The government disputes this, and that the use of the drones without the necessary improvement in the human resource capacity will not be beneficial to the country. After all, the GMA maintained. They want the government to rather take steps to improve the referral systems, especially in emergency situations. That's what they want government to look at first. What's government reaction to this? Government is accusing the GMA of double standards. The GMA doesn't take kindly to this at all, and they've been fighting this the whole of today. We know that government maintains there will be no turning back on this. You're going ahead with implementation. The 12.5 million is going to cost us, will be paid to Zipline, the contractors, to go ahead with implementation. So, and we know today there have been a meeting with the Vice President where the Zipline itself was part, but the Ghana Medical Association was part, and a statement from there will be interrogating shortly. Essentially says that consultations will now happen post the approval, but also the question about what happens with the demand to suspend, we don't know yet. So will the use of the drones without the necessary improvement in the human resource capacity benefit this country? And how do we implement this in reality? Forget about the concept. We've moved on from the concept. But the concept that was dreamt up by the Vice President and others is one thing. At this stage, we are implementing it. How do we do that, knowing all the challenges that we have in the health sector? We put together experts in their fields, in the medical field. We'll be joined also by a member of government to try and interrogate this so you can, I guess, make your own decision whether this will eventually benefit you, having heard all sides of this in terms of implementation. Stay with us here on PM Express. When we return, we'll have that conversation. My guest in the studio tonight will be speaking to the Vice President of the Ghana Association of Medical Laboratory Scientists, Robert Adjidekpodo. Yes, Robert Adjidekpodo is the Vice President of the Ghana Association of Medical Laboratories Scientists. Also joining us in the studio is Dr. Hadi Mohammed Abdullah, Specialist Surgeon at the Kolebu Teaching Hospital, a member of the Ghana Medical Association with strong views on this matter. We'll be joined shortly by Deputy Information Minister Pius Enam Hadzide. I want to start with a statement that we got just a couple of hours back from the Information Ministry following a meeting that was held between the Vice President and some of the interested parties in this matter. And it reads that following the passage by Parliament of the Ministry of Health Drones for Medical Supplies Agreement and the subsequent call by the GMA for the suspension of the project to allow for further consultation, a meeting was held today between the Ministry of Health, Ghana Health Service, the Ministry of Health, Ghana Health Service, and the Ghana Medical Association, and Zipline under the chairmanship of the Vice President. He says the discussions were very fruitful and productive. It was agreed that going forward, the Ministry of Health and the Ghana Health Service will engage in a process of enhanced consultation with the GMA and other stakeholders in the process of implementation of the Drones for Medical Supplies project. The meeting was attended by Dr. Mahamadou Bawumia, who is the Vice President, Mr. Kweku Ajimamenu, Minister for Health, Dr. Nsia Sare, who is the Director General of the Ghana Health Service, Dr. Frank Ankobia, who is the President of the GMA, and Dr. Frank Sribo, Vice President of the GMA, and Dr. Justice Yangsing, Secretary GMA, and Mr. Daniel Bafo with Zipline. This is signed by Pius Enam Hadzide, who will join us very shortly. Let me start with you, Hadi. Is this progress? Is this something that does it appease you as a medical doctor and a member of the GMA that they're finally going to consult your leadership?
Well, honestly, I don't want to sound very harsh, but for me, I see it like an insult to the association and intelligence of the members of the Ghana Medical Association. You release a statement which purports to give the impression that the GMA was consulted. You go ahead defying all odds and views to pass or agree to the contract. I mean, Parliament, and I've seen the number of people who voted. Unfortunately, we cannot pick out exactly those who voted for and against, as is done in other countries. And then GMA released a statement. All of a sudden, this meeting is held. And I was told it was a very short meeting, basically to discuss the misrepresentation of our General Secretary by the Deputy Minister of Health. And then all of a sudden, a statement is released. I've led junior doctors in this country before. I've been involved in meetings with government. This has never happened before. Why? Why should a meeting between 3 members of the Ghana Medical Association, a short meeting at the ministry, all of a sudden then they release a statement? Well, me personally, I see it as an insult to our intelligence. A big insult. And I'm sure I'm not the only one who
thinks better late than never. At least the consultation is going to happen. Post the approval.
I can clearly see through what this was meant to do. It is a pure act of propaganda.
What is it?
And I challenge anybody, especially the one who wrote or signed that letter. Why the rush? Why the rush to release that statement? It is all because they want to save their faces. It's like an egg thrown in their face. It's a face-saving venture. And honestly, I see it as an insult to the Ghana Medical Association. I will not give them any credit for that.
I see. We'll come to that's where we are tonight with the. But now there's going to be consultations. I mean, having expressed those views, you requested for consultations. Your leadership did. don't you at least welcome the fact that there's going to be consultation?
I thought that even the statement will come with the fact, we're going to heed to the advice of the GMA, and hold on with the implementation of it.
Okay.
I listened to your program somewhere around 5:30 thereabout, and it appears they will go ahead and implement it. So,
the Deputy Minister said,
so far as I'm concerned, with all the discussion which has gone on, and the way things are done in this country, as I've seen since 1992, when government want to take a decision, they go ahead and take it. It's more about their interest. I don't think this serves the interest of Ghanaians, because if it really serves the interest of Ghanaians, and considering the discussions, especially within this week, there's been a lot of discussion, and I was hoping that they will listen to the professional bodies before they go ahead. They just wanted to push it, and it's very sad.
Okay, we'll be interrogating, and that's why I brought the professionals here, because in the end, you will implement this. You would have to place a request sometime, and the drones will have to deliver blood to you. And so don't comment on that. I'll get you to tell me in very practical terms, because the fundamental theme of the conversation is looking at the concept and the reality. Let me bring in the Vice President of the Ghana Association of Medical Laboratory Scientists. Were you also consulted at all?
Thank you, Evans, and good evening to your cherished listeners and the viewers. It's a sad moment for all of us. Medical laboratory scientists across the country performs over 70% of this blood issue that we are talking about.
Okay, so what do you do with the blood exactly? What's your role in that?
Yes, before the blood is even gotten from the donors.
Okay.
When you go to the district hospitals, we don't have blood donor organizers, we don't have nurse donor bleeders. So the medical
you have to break it down. Nurse donor bleeders.
Bleeders, those who will take blood from the donors.
Okay.
When you go to the teaching hospital, regional hospital, they have those systems. But when it comes to the district hospital, then the lab scientists become the blood donor organizers. They also become the nurse donor bleeders.
Okay, you have to break these down.
For the blood donor organizers, we go to the schools, the churches, to go and give talk on blood donation for them to donate. So when they are okay for all that we have given to them, then they donate to us. Then from there, we come to the lab. But before the blood donation, that's why I said that the lab scientists become the nurse blood donors.
Okay.
We bleed them. The lab scientists are supposed to be in the lab and receive all those things, but because we don't have the number, we don't have the blood donor organizer, we don't have those nurse bleeders in the district.
So you do the legwork yourself?
We do a lot of work, and most of the time, as I say, it's close to 90% of the work when it comes to blood issue. And we are even not even consulted.
Okay, so apart from bleeding me, if I come to your hospital to donate, and going to campaign for the donation, in terms of storage, etc., what the lab scientists do, in terms of testing the blood to ensure that it's it's compatible with the various blood groups. What role do you play there as well?
Even that's the exact point that you are making. I am happy. You are not in the medical field, but you understand this thing. So I'm surprised if leaders in the health sector will never or even understand this thing, then we are in a big problem. Yeah. So when the blood is collected, we cannot just give that blood. You need to screen the blood, ensure that the blood is safe for transfusion. And those are critical roles that the lab scientists play. We also do what we call blood grouping. We need to know the type of blood that the person is having.
So you have to ensure the blood is safe?
Yes.
It's not contaminated?
Yes.
Okay.
So we have to also ensure that the blood, where we are going to take the blood from, the donor is also safe.
Okay.
Because if the donor's blood level is not up to a certain level and you take it, it can also give you a problem. Okay. So those are the things that we face in the district.
Okay.
Now, this drone issue, let me put it on record.
Oh, you haven't finished what you do.
Let me put it on record. There's an issue that medical lab scientists are against the drone. It is never true.
Okay, so I think we'll come to that. But I want to let's understand what you do.
Yes.
So I think you've now explained that you, after the blood is taken, which you also do, you ensure it is safe.
Yes.
You ensure the person giving it himself is in a position to give the blood.
Exactly.
Do you also do the testing of the blood to ensure?
That is the sole responsibility of medical laboratory scientists in this country.
Yourselves?
Yes.
Okay. Which is a very important part of the process.
Exactly. We will come to.
So you have to tell her what group it belongs.
Exactly.
Okay.
And after that, when we get the blood, we have to prepare the blood into various components.
What does it mean, components?
Blood, as you are saying, we can prepare what we call fresh frozen plasma.
Okay.
You also prepare cryoprecipitate. You also prepare...
I'm pretending I understand, I don't.
Yes. We also prepare concentrated red cells and then the whole cell. So these are the components that we prepare.
So blood is not blood?
Blood is not blood. So we also need equipment to prepare all those things. And as I'm saying, those things are not in place. They are not even in the district hospital at all. So when blood is needed, then what we do is to just give a whole blood, which of course, that particular person might not need the whole blood. It might need only a component of that, which must be manufactured or prepared by the professional. I'm talking about medical laboratory scientists here. But we are not even in the equation. Okay, so it's a sad moment.
Having told us what you do, and I think it's so essential to this drones policy, you say you haven't been consulted?
Not at all. Not at all. And we have issued a press statement ahead of time. And till date, nobody even minus. The system that we are playing in this health system is sad. It's sad because health system is a teamwork. Wherever that you have ended, somebody has to take it up from there. But it seems that teamwork is not there. That consultation is not there. And as I said, medical laboratory scientists play over 80% of this blood donation that we are talking about.
Okay. Can you do your work without them as a doctor?
Oh no, I mean definitely, especially as a surgeon, I would need them to work. They just don't organize the blood for us. But like you said, some of the blood product, there are people with bleeding disorders, for example, who need to be operated on. So some of the products that he mentioned, we need to send those products to theater and still make sure that the person is saved.
Okay, that's interesting. So what you're saying is that if you're in a theater and you need blood and you call and the blood comes, you're trusting that he's done his job.
Yes.
And that when you take the blood, you can transfuse.
Yes, because before they give me the blood, usually I'll take the patient's blood and send it for them to check for the compatibility. And then also each blood donated by the community or from voluntary donors, they screen it. So they screen for malaria, hepatitis, HIV, AIDS, and all that. And then they also ensure that some of the product, as he mentioned, could last up to about 42 days, some up to like 90 days. Yes, blood can expire. And then even if all these checks have been done, we can still have what we call blood transfusion reaction.
That is a very important part.
It's so important.
Which can kill.
It can kill instantly.
That is if you don't do the transfusion properly.
Yes.
Hold on there for me. Because that's what we'll be discussing. And we've just been joined by the Deputy Information Minister, because we're now going to be discussing, now that we understood what goes into storage of blood and getting it safe, etc. So how will this then work in reality once the drones have been deployed? Stay with us. When we'll return, we'll be interrogating that. We're just being joined in the studio by Hadzide. He's a Deputy Information Minister, joining the conversation as we begin to look into the actual implementation of this policy, which was approved by Parliament going forward. Pius, so we're at a point where government says there's going to be consultation. However, the consultation, from its connotation, means that you value what you're going to hear from the GMA. That whatever they say should be, positions such that it can influence the shaping of the policy going forward. Is there room for that? And I ask that because the GMA had asked for a suspension so you can consult and improve it and then roll it out. They were not against it. But it appears the implementation is going to go ahead regardless, correct?
Yeah, thank you very much, Evans. And I have to apologize for coming in late. When your producers got me, I was very, very far away, but I had to rush to partake in the discussion. And let me also seize this opportunity to say a big thank you to especially the executives of the Ghana Medical Association who attended at today's meeting that was chaired by His Excellency the Vice President. It was very fruitful, it was productive, and we think that it is a step in further enhancing the consultation. It is not the end. This is a continuation of the process, and we shall continue to do this. And to speak to the question of whether we are going to suspend the implementation, I think that that is not the understanding that was derived. There are several stakeholders. Today we have had a very successful meeting with the GMA, but the consultations need to expand beyond the GMA, and there are other important stakeholders in the health delivery.
So we have here the Vice President of the Ghana Association of Medical Lab Scientists.
So
they actually deal with the blood.
So they are a critical part of the health delivery ecosystem, and so we cannot be saying that as and when any stakeholder makes a demand that pull the brakes, you pull it. I mean, we cannot make progress that way. We think that we can expand the scope and further enhance the consultation. And so I think that the understanding has been generated that government would proceed now that Parliament has given parliamentary approval.
Constitution starting immediately.
To
well, this is being rolled out next year.
Yes.
Okay. You hope to finish the consultation before the actual rollout. Is that the plan?
Well, the whole point about the consultation is the question of the implementation. I mean, the people's representatives, the elected representatives of the people of Ghana, the members of parliament, have accepted this deal, and they and only they have the mandate and the legal constitutional authority to accept these things, and they have done that. And so the consultations, in my estimation, revolves around implementation and the technical issues around which. So we will proceed along the implementation.
So you seek their inputs to influence the actual implementation. Is that
yes?
It? Okay. So let's deal with that then, because that's why we're having this conversation. Dr. Abdullah, you are a specialist, and so you are a senior officer in the medical profession. Yeah. Let's look at implementation.
Well, before I move to the implementation, I just want to give you this example. By law, your father is your benefactor. Now, can you tell me that if you have a 16-year-old child in SSS, okay, a girl, the father can decide to go and play buy football or tennis and say that I'm your father, so I want you to play tennis. So henceforth, you are going to learn how to play tennis. Would you accept it? You will not. Nobody would accept it, especially in democracy such as this. Now, when it comes to this policy, I'm a scientist, at the same time a medical person. For us, it's always important to talk about figures and scientific studies. Now, what studies was done by the Ghana Health Service or the Ministry of Health to make them come to this conclusion that this is what we need at this moment? And so far, what I've heard is about blood.
And medical supplies,
yes.
Essential medical supplies.
Yes, but when it even comes to care, especially primary health care, your 5 or 10 top causes of death is very important.
What are they?
In Ghana, currently, you have neonatal deaths, okay, which usually from infection. You have malaria, you have tuberculosis. You have now, because of cardiovascular event and vascular event which occurs, you could have stroke has moved up. Okay. You have heart attacks which have also moved out. You have diabetes and then kidney diseases, including road traffic accidents. Road traffic accident actually forms about 24% of our death. in the various hospitals that we operate in, especially I work in Kolebu, we have the National Blood Bank there.
Okay.
Stocking even the center is a problem. Getting blood for a patient in Kolebu today, sometimes it's a big challenge.
You're not
Yes.
exaggerating, right?
I'm
because
not,
this is
I'm
Kolebu.
not,
How
yes,
can Kolebu
I'm
have a
not,
challenge in
I'm
getting
not
blood?
exaggerating.
You mean the headquarters of the blood bank is at Kolebu?
Yes.
So what is the challenge exactly?
The challenge is that people are not donating.
Okay.
What is the policy to drive people to donate? I mean, my job, I'm sure multimedia has organized blood donation campaigns before. He's here. I'm sure he can bear me out. We are not donating. These are the fundamental issues which needs to be tackled first, instead of what I see as fantasy. Because so far as I'm concerned, this drone policy was first introduced in Africa.
Yes, true.
By a company which, even after the introduction, has a value of about $43 million. What is the contract that we just signed with them? I've heard 12 million, I've heard 27 million. For a company whose value is up to 43 million. And you realize that the target has been Africa, especially in a state such as Rwanda, where there is this desire to paint the government good, make the government look good, let them seem as if they are tech savvy. Have you listened to what even the opposition there are saying? Why is Africa the target? Do you understand? And that is why I feel that to have considered this issue, fine, you may have a brilliant idea, you want to save Ghanaians, but it is important that any venture that you take in the healthcare sector, you must marry it with scientific fact. You just can't get up and then say that, oh, this is what we need, especially in a country that we don't have adequate ambulances. There are so many regions in this country, especially when you go to the Upper West region. They don't have doctors. Meanwhile, you have so many doctors who complete their house job and they're at home. Many years ago, we did not have this problem. But if you go to the Upper West, Upper East region, they're one of the poorest doctor-to-patient ratio in this country. These are the fundamental things.
How will that affect the drone policy?
Okay. Now, these are the ones who are going to implement this particular policy. These are the doctors who are going to request for the blood, who has done a study, say in the Upper West region, to find out the blood need of the hospitals there, or this emergency care that we've talked about. Can they point to a single study which has been done to tell us that this is what we really need at this moment?
Final question to you. You mentioned ambulances. Isn't it that the reason why we need the drones? Because even if we have the ambulances, we know the nature of our roads.
Yes.
It's terrible in these areas. The drones, they don't have to deal with that problem. They can get there faster. They don't have to struggle to the bad, terrible roads that we have that will destroy the ambulances in a short period of time. Isn't that why and you mentioned in the list of top causes of death, road accidents.
Yes.
Road accidents, 24% I think you mentioned. People, if that's the case, people are going to bleed, right? And you need blood. If you don't have ambulances, it's cheaper, I guess, to get them drones. Why don't you? Isn't that a justification for the government?
It's easier said than done. Who is going to even assess the patient and say that this patient needs blood?
The doctor or the nurse.
And the doctor is sitting at home. He's unemployed. He's unemployed. So who is going to make that assessment?
Let me bring your colleagues.
So it's just about just jumping the gun and not doing the right thing. If we employ the doctors, employ the nurse, and he's even mentioned, I'm sure he missed that part. Even on the ground, they don't have enough of the bleeders. They don't have enough laboratories.
Those who take the blood for storage.
And this group of people are very important.
Let me hear from him on this. And Powers, I'll come to you. I want you to listen to what, and I'll come to you. I'll give enough time to respond to everything. I know you've made notes. Robert, so you, from the laboratory scientist point of view, I know you also had a statement, right? You are not against the policy.
At all.
Okay? But in terms of implementation, can this work? Can work with government to get the drones to deliver? Well, what is the challenge as far as you see it with implementation and the work you've done?
Yeah, how do you rightly put it, that for somebody to even request for blood transfusion, it should be done by a qualified medical officer. And he said that they are not, or they are in the house. And when the request is made, the test must be done by a qualified medical laboratory scientist, which in this case is not even in the
But the drone centers will have qualified medical laboratory scientists.
Yeah, I'll come to that. We are talking about a process. When the blood is even sent by the drone, there must be cross-matching. You must cross-match that blood to ensure that this blood will be compatible or not. But in our case, what we are talking about here is that those on cross-matched blood can be given to the client, which is dangerous.
But the doctors who make the request, who have stated what blood group that patient requires.
I am surprised that our leaders don't know this, especially those in the health. Blood cannot just be given. The fact that you know somebody's blood group, maybe blood group A, doesn't mean we can just give blood group A to that person. There might be some problem. So, and that is the reason why we do cross-matching, just to cross-match the blood to ensure that what we have done earlier and what we are doing doesn't different. It's not different. So if you overlook this, then the patients will be at risk. That's the dangerous venture. You cannot give any blood to anybody without first cross-matching, which must be done by a qualified medical laboratory scientist. And these are the issues that we are talking about. The implementation, there's a challenge. Who is going to do that in the village? And when there's a problem, as I said earlier, we have blood and blood components. You cannot just request for any blood at all to be used. And the one who is going to even request for this blood, is he qualified to do that?
Yeah.
Before you even do the blood transfusion, you need to know the person's status. Which blood group does it belong to? Does this person need that blood? Sometimes the person might be bleeding, but we may not need a whole blood.
Which you experience, especially in the remotest parts of the country, which really fundamentally this drones problem solution, this drones policy will solve. Is it your view that we don't have these qualified people like yourselves, qualified medical laboratory scientists in these areas to make these determinations?
We are talking about the rural or the remote areas where we don't have qualified personnel there. They are not there.
Okay.
Those people that you see will be at the district hospital and the regional hospital level. This is where the issue is.
But these hospitals also need blood to be flown in, so they will have the doctors anyway.
But the problem now is that it's not about distribution. As he rightly said, the blood is not even in Kolebu.
Okay.
Let me use myself as an example. When my wife was about to deliver, I was asked to bring blood, and I had to donate my own blood from my district to Accra.
Which district was this?
Southtown district.
Well, because you didn't find available blood anywhere?
The blood is not there.
Okay.
Even right in Kolebu, when people are going to deliver, they ask them to look for blood.
But the drones could have saved your wife. How? Because the drones would have been in a center which would have stocked blood.
My wife is in Kolebu. My wife was admitted in Kolebu maternity block. And Kolebu, where the blood transfusion service is saying that there's no blood for me for me to bring
so
blood
your wife
from
was
the
at
district.
Kolebu?
Exactly.
So and they asked you to bring blood from the district?
They asked me to look for blood.
That's
and
strange.
I am a donor. I am a voluntary donor. And my
Kolebu
blood,
couldn't find blood at Kolebu?
I'm saying that that is the policy now in Kolebu. When you are going to deliver, you need to look for people to donate for you.
Yeah, but if that's the case, the drone center closest to Kolebu would have brought the blood.
From where?
That drone center will stop blood. It's part
the issue is not about distribution.
I think
the issue is not about distribution at all.
Oversimplifying the issue. The issue is that Ghanaians are not donating. So we don't have
the blood is not there. So what are we going to distribute?
The drone policy sought to suggest that we have enough blood stock. Absolutely. And the problem is with transportation.
Okay. Absolutely.
Those are the issues.
Okay. So you're saying...
But as we speak now, we don't have enough blood.
So what you're saying is that you can roll out the drones policy and they won't find blood to
transport.
There's no blood. Okay, let me hear from you.
No, but let me just finish on this.
Briefly, because I want you to respond. Very briefly.
You see, and every surgeon will bear me out. The most important management of a victim, either whether the person is bleeding from just after delivery or during accident, is to stop the bleeding.
The bleeding, not
if you can't stop the
What does
bleeding, you can give.
oxytocin do?
Oxytocin is a drug which helps to contract the uterus.
Yeah.
So after delivery, when the uterus is flabby, it has the risks of bleeding.
Yeah, but
If
that's
it
part of
continues
the things that the drones primarily will be delivering.
but oxytocin should be stocked in our hospitals.
In case you don't have it.
No, please. You see, these are basic.
Okay.
These are basic drugs.
Okay.
No, and it's important. I really want to make this point.
Very briefly.
Really want to make this point. The point is that if you don't have the personnel to stop the bleeding, you can give 1,000 units of blood and it won't work.
Okay. Pius.
Evans, I thank you very much. I think that as a country, if we could just engage more with government and listen more, and the listening should be two ways. When people speak and expect government to listen, when government speak, people should also expect to listen. Because I've been listening, and I think that as practitioners in the industry, we should rather be excited, because the problems that I keep hearing, I see that this is one of the steps in getting the solution. And I'll take them one by one.
Please do.
We have explained that this is a service contract. So that if your argument is that there is no blood for the drone to take, then the drone will not even fly. So nobody even pays a dime. So what should be the worry about that? If you're saying that there is no blood for the drone to fly, it is a service contract, and you are going to be paid per flight or per a delivery. So if there is no blood, then there is no flight, and then there's no money to pay. So it imposes an obligation on anybody who wants to fly any drone to even find the blood.
To stock the blood.
And so for me, this argument that there's no blood, look, in my church.
So what, Zipline will stock the blood?
No,
Okay.
I'm saying that we have identified the problem, we have talked about it. You do not lose if there's no blood to even fry. Per this agreement, you do not lose because you don't pay anything. So that argument doesn't arise. One of the critical reasons why people do not even donate blood in this country is that the blood that is donated goes to waste. I have in my because of storage and usage. There is over concentration somewhere, and there is demand somewhere, and the distance is just large, so that somebody has to find blood maybe in Central Tong or South Tong. Okay, there is blood in Central Tong, but there is no blood in Accra. So after some time, the blood that is in Central Tong, but which may not at that point be needed in Central Tong, will go waste. So next time, what is the motivation in somebody in Central Tong to go and donate blood when the person knows that the blood that I donated the last time went bad and was thrown away? So the point is that let us take time and let us not oppose just because we have to oppose something. Let us engage with each other and understand, and let's point out the essentials. The argument about we have other challenges, it is true. Nobody has pretended that this is the panacea to all of our health problems. It cannot be. The issues of recruitment into the health sector are still on the plate. And in fact, if you check our recent history, this government is one of the governments that have employed the most into the health sector within these 2 short years. In 2017 alone, over 16,000 health professionals were recruited. And I can go on and on, even about 2018. And no, I'm saying to you that those challenges will be fixed gradually. We can walk and chew gum. Let not it be said that we have to wait and employ all the doctors that we need. We have to wait to employ all the lab technicians, as wonderful as they are and as much as we need them, and employ all the nurses before we think of even maybe stocking the drugs. Because the argument, if you stretch it, can be that, well, if there are no nurses, so why are we even buying the drugs in the first place? Because there will not be doctors and nurses to administer the drugs. But we still buy drugs. We can walk and chew gum. We are developing as a country. And so it takes a creative government to want to resolve some of these challenges. And let me illustrate to you how I find this as a solution. We are talking about centralizing all these things. at a point, so that in the case my brother's wife needs blood, Evans, he didn't tell you how he transported the blood from Tong to Kolebu. He took car. He took a car. It would have taken him at least 2 hours from, I know the place very well. It would have taken him even, in fact, 3 hours.
The drones would have delivered it maximum 40 minutes.
In 15 minutes, assuming that the wife's condition was critical and there was an emergency need for blood. He was now going to run to Tong and buy blood, get on a taxi or get on a trotro, or if he, I'm sure he has a good car, get into his car and drive to Accra. That takes time. The drones would have delivered it quicker. So I see solutions. I see solving of the problem. But I think that we are convoluting the argument and mixing everything. Nobody is saying that once we have drones, we are not going to employ nurses or health workers. In fact, as we speak to you now, we are working at getting a clearance for several other thousands of workers into the health sector. So it is not that we are saying that this is a one-stop solution to all of our health needs.
Okay.
But the argument has been made that when you go to Rwanda, Rwanda is hilly, and even if there were the roads, like I tried to illustrate now, even if there were the roads, we need time to do this. But sometimes, the challenge I have is that when our professionals speak, they should speak devoid of the politics and leave the politics to some of us.
But they haven't solved our politics.
Yeah, but I'm saying no, the politics is not necessarily MPP or NDC. I'm coming to I'm not, and I'm saying that the politics is not just the mention of MPP or NDC.
Yeah.
You understand? For me, if you're saying that, well, you haven't fixed the recruitment problems, or you haven't fixed the roads, you haven't fixed the drugs are not even there, that is political talk.
How is that?
Because you know what? I'll explain. I'll explain to you. It is. I'll tell you why. I'll tell you why.
The man is speaking from a point of view.
I'll tell you.
I'm a professional.
No, I'll tell you why.
And I'm telling you, decentralize it.
I'll tell you.
Decentralize it and take advantage.
I'll tell you why. From the professional. No, they took all the time, Evans. And there are two of them. There are two of them against me. Now, from the professional point of view, from the professional point of view, the professionals know that if you check our health infrastructure, majority of our facilities are on the lower side of the ladder. CHIPS compounds, health posts, clinics, and so on and so forth. And that storage capacity in those facilities are non-existent. And so they know that the blood and the oxytocins and the emergency drugs, that some of them which require storage in a certain condition cannot be stored in a CHIPS compound. So you can't, even if it can, it takes much more money to build these storage facilities.
But the CHIPS compound doesn't have. Let me hear from your reaction to this briefly.
Look, I really take a great exception to him saying that we are doing politics. We are professionals, and Evans know. I've had experience in a district hospital in Winneba before, so I understand these issues very well. The issue is, when I sit in Kolebu, I am faced with simple matters which, when resolved, could have led to the saving of life and limb. As I speak today, we have just 55 ambulances.
In the whole of the country?
Yes. This is a fact.
You see the politics?
No.
But he interjected. He said to me, he interjected. But he knows that this government has begun procurement for 275 ambulances plus more. He knows that.
Please, we just started discussing this thing last week. So please, let me finish. And please don't interject, I beg you.
But you are interjecting, sir.
I beg you.
I had to make the point because you have to wrap up in 2 minutes.
Now, the CT scan machine in most of our hospitals today in Accra are not working. Okay? I have children who need surgery And because I have only one theater as a neurosurgeon, with over 10 neurosurgeons, one of the highest in the sub-region, people with brain tumors are dying.
So you mean there are fundamental...
Very fundamental
that
things.
needs to address it.
I don't think it has come...
But he says that you can work and chew gum at the same time.
Absolutely.
We shouldn't address all these before we fix it.
And what I'm saying is, well, all I need is for my theater to be fixed. The theater, I need a theater machine. For the past 5 years, I've not had it. Meanwhile,
all he needed was blood for his wife in good time.
Let him.
Now, that theater machine, okay, is going to cost just $150,000.
Okay.
We couldn't cough up that money. People have gone blind. People have died. And you remember,
yeah, I do.
We carried one of those stories. Do you know that the cost of those lives that we lose?
So fix the fundamental.
And this is $150,000. Now, and I'm throwing out this alternative again.
Okay.
Now, a helicopter, okay, can cost between $250,000 to $750,000.
Yes. What?
This is a machine which has the capacity not just to carry.
What costing is that?
No, not just to carry just medications of blood, but can take somebody from the accident scene
to the referral center.
Okay, to the referral center, and the person will get the right treatment.
Okay.
Have you also looked at that alternative if we want to go on this
Absolutely.
Robert, so for as far as you're concerned, what would it take for this? Because you support it fundamentally.
Yes.
What would you take for this to be rolled out in the way that will be effective? Very briefly.
Yeah, we think that this policy, we can have we can do it maybe at some selected areas to start with, and see how it will work.
So it comes out to the piloting conversation.
Then the other issue is that the laboratory, we have a policy for laboratory in this country since 2013. That policy document is lying at the ministry, which of course will address most of this challenge that we are having currently. You remember the Kompanoche and the King Hospital issue. Those are the issues that we even went on strike over to ensure that the system
representatives don't pass those ones.
So we need to look at the fundamentals first, before we can move to the next.
I'm grateful that you.
And what is said about blood expiring, what happened at the district is that when people need blood, that is when you look for the donors, and that blood will be used immediately. So we're talking about blood.
There's not even stock. But it says the solution is that there will be a center that will already have the stock.
You want to centralize.
And properly refrigerate.
So even you believe in centralization.
Secondly, we are talking about medical laboratory scientists since 2012 have not been employed.
I'm grateful that you joined us. Piles, this is a conversation that will continue going forward, because as you engage, this is part of the consultations. So I'm grateful.
They won't see it as such.
No, they will.
They've already passed it.
And note that all of them say they support it, but they believe that implementation is something that you need to look at.
What I need is a theater to operate on my
Information Minister. Hadi Mohammed is
all he needed was blood for the wife in good time. That's all he needed.
My name is Evans Prince. Enjoy your day.